One of the main reasons or indications for doing a hysterectomy in women is uterine prolapse, when the uterus is falling out. So in the United States is one of the main indications, and almost about 100,000 patients or hysterectomies are performed for pelvic organ prolapse. Did you know in 1933, Professor Ward in England, a gynecologist, said hysterectomy as a cure for prolapse is useless, and the very worst type of prolapse is one that occurs after hysterectomy has been performed. Can you imagine? The worst type of prolapse happens after hysterectomy has been performed. This is what he mentioned over a century back. And we are still doing a hysterectomy. That makes no sense. What is the opposite? The thing to do is uterine sparing procedure. Keep the uterus, don't take it out. And that is called hysterectomy, leaving the uterus in. Do you know in the United States, only 5% of uterine sparing procedures are performed for uterine prolapse? That's so low. In the Netherlands and in Europe, that is the preferred technique, where they do not take the uterus out, they leave the uterus in. And there are some benefits of leaving the uterus in, and there are multiple benefits, not just one. And it makes complete sense to leave it inside because the uterus is very tiny. It is very small. It is just falling out because it has the ligamentous and the muscle weakness that is making it fall out. Now, if you recreate those ligaments and the muscles, the uterus goes up. So as you can see in this slide, the uterus is falling down like the boat in that water. Now you recreate the water, you could recreate the ligaments, and guess what? It's back up. So by keeping the uterus in is the treatment. Taking it out is unnecessary. And this is 100-year information. At AUGM, we do not take the uterus out. We leave the uterus in. And classically, over the past at least 15 years, I've been doing this uterine sparing surgery for uterine prolapse.